Hi, my name is Mary Grace, and today I will be doing a skills video performing inserting an IV and discontinuing. Today I am in proper school attire. My name badge is visible. I do not have any nail polish, nor do I have any jewelry on. The supplies I will be using today are two pairs of gloves, my IV extension tube, an IV needle, which is going to be a 22 gauge with 1-inch catheter, my saline, an IV start kit, and Mr. Smith's forearm. I have identified Mr. Smith's identity and confirmed his date of birth. He is an elderly patient who is coming in for IV fluids. To start off, I will be doing hand hygiene, putting on my gloves, and then I'm going to set up my supplies. All of these supplies have been manipulated for practice purposes. Okay. Okay, got the alcohol, gauze, sterile dressing, and tourniquet. Okay, perfect. So once all my supplies are set, I will be priming my my extension tube. So here's my extension tube. I'm going to be taking off the cap of the saline, and I'm going to attach. So now that it is securely attached, I am going to release the clamp, and I want to make sure that there are no bubbles in the tubing. I will be inserting some saline, and I just want to check for a few drops of fluid coming out of the other end. Perfect. I see fluid, and now I'm going to clamp the tubing back. I'm going to clamp the tubing back and put it to the side for later. Now I'm going to go to Mr. Smith's forearm and attach the tourniquet. I want to make sure that I attach the tourniquet above 4 to 6 inches above the insertion site. Okay, so the tourniquet is attached. I'm going to take my 4 fingers and I'm going to measure. Perfect. The tourniquet is above 4 inches from the insertion site. Now I want to make sure that the tourniquet is also not too tight. I'm going to take my fingers here and I'm going to feel for a distal pulse. Okay, I feel the distal pulse. Now I'm going to get my sterile, my alcohol swab, and I'm going to clean from the center outward. Great, now I can dispose. I'm going to get my needle, and I want to make sure that before doing anything, I have to make sure that the needle is bevel up. Okay, the needle is bevel up. I'm going to take my fingers, my middle finger, and I'm going to anchor the vein. Now that the vein is anchored, I'm going to take my bevel up needle and insert the needle in Mr. Smith's arm here, 30-degree angle. Okay, the needle is inserted. I'm checking to see if there's any blood flow here. I do see the blood flow. And now I'm going to even out and insert 1/4 more. Great. Now that the IV is inserted properly, I'm going to remove the catheter from the needle. while I secure the vein. Now, for practice purposes, in the real world, I would be pressing the safety mechanism here, so the needle could retract for safety purposes. But because I want to continue practicing, I will not be doing that today. But in the real world, I would be pressing this safety mechanism right here. Now I am putting this in the sharps container. And while I am securing the IV site, I am going to get my saline and tube here, and I'm going to attach the two sections. Perfect, it is now attached. I'm going to release my tourniquet and unclamp. So I'm going to withdraw here so I can see if there's blood flow coming back. I do see it. Perfect. Now I will slowly push in the saline. Great. The saline is all done. I am going to clamp the tube again. Clamp the tube again, and I'm going to discontinue the saline with the tube while I hold and place, while I make sure and hold the catheter. So it's secured, and I'm going to discard this. Now I need to grab my sterile dressing. And once again, for training purposes, this would be taken off the back part here, but once I take it off and apply it, I can't reuse it, and I would like to continue practicing. So in real life, I would be taking this part off, but for this video, I will not. I am going to place it on top of the IV site, but not on any of the extension tubes, just in case it needs to be changed. While securing it, so now that it is placed on the IV site, I'm going to grab tape and tape the tube onto the patient's arm. Okay, now the tube is taped there. Now the tube is taped there. I'm going to remove the remaining of, I'm going to be removing the rest of this top part here where it says initials, date. So once that is removed, I am going to initials here. I'm going to initial, I'm going to date it, and I'm going to put what I used, which is a 22 gauge 1-inch needle. After that, that IV thing is set. The tourniquet is already off by that point. It's just stuck there because it's not a real arm. But once that is set, I am done with the IV portion. I'm going to be removing my gloves, discard, and hand hygiene. And now I can leave the patient's room. So for discontinuing, I have to make sure I have all my supplies, right? So, okay, for discontinuing, I'm going back into the patient's room. I have my supplies, which is gloves and 2 gauze and tape. I need tape. Perfect. Okay, I will do hand, let me clean up first. Okay, so now I have everything ready. I'm going to do hand hygiene. I'm back in the patient's room, hand hygiene, and now I'm going to be putting on my gloves. I will slowly remove the tape from the external tube there, and while securing the IV site, I'm going to be slowly removing the sterile dressing. Okay, so that is done. Now I'm going to be removing the catheter. Oh, before I do that, I'm going to get gauze and I'm going to put it on top of the on top of the IV. So now I'm going to slowly remove the catheter. And I want to inspect the catheter and make sure that all of the equipment for the IV is in place or intact. And I need to double check the length. This is a 1-inch length, so everything is good there. And now I will discard that in the sharps container. I will hold the gauze here for 30 seconds, make sure that there's no bleeding. It has been 30 seconds. I'm double checking. Perfect, there is no blood, so I will discard that. And I will get a new gauze here, place it on top of the insertion site and get my tape and place my tape on top. I am done. After that, take off my gloves. Take off my gloves here, do my proper hand hygiene, make sure I have no other supplies needed. I am good, and I will leave the patient's room.